multiple sclerosis, Parkinson disease, and Huntington disease. These are three chronic neurological disorders that we're going over in my pathophysiology class right now. So I want to run down a quick patho on each of these three disorders. Multiple sclerosis, so it's kind of cut off at the top up here, but the patho of multiple sclerosis is actually an autoimmune issue that causes demyelination of neurons in the brain, spinal cord, and the optic nerve. So that means that the myelin sheath that kind of coats and protects neurons is being damaged and actually being replaced with scar tissue, forming plaques in the ventricles of the brain stem, and the optic nerve. Multiple sclerosis actually means many scars. So looking at signs and symptoms of multiple sclerosis. So with many scars forming in all these different areas, literally the ventricles, the brain stem, and the optic nerve, we're going to have a very wide range of signs and symptoms. So the earliest signs and symptoms are always the most vague, right? So the patient may start to feel some weakness. So the weakness will then progress to possibly some loss of balance, some ataxia or an ataxic gait, which is difficulty walking. They may have some dysphagia or difficulty swallowing. And since the optic nerve is affected, there may be some blurred vision or some double vision that the patient starts to report. It's also very important to remember that multiple sclerosis is characterized by remission and relapse. So these patients can go months even with no signs or symptoms, be exposed to some sort of trigger like stress or illness, and then relapse. So it's important to remember that remission and relapse is very classic to multiple sclerosis. And we diagnose definitively multiple sclerosis by visualizing these plaques that are formed on MRI. Okay, so Parkinson is next. With Parkinson, we haven't really identified a cause. We have speculated, looking at a possible history of encephalitis, even some antipsychotic drugs as coming into play with setting into motion the patho of Parkinson. But for whatever reason, there are progressive degenerative changes in the substantia nigra. This leads to loss of dopamine secreting neurons. Okay, so that loss of dopamine is absolutely key when we're talking about the patho of Parkinson's, because dopamine is an inhibitory neurotransmitter. So it kind of keeps our movement in check and keeps it deliberate. And so with that loss of dopamine comes increased abnormal, uncontrolled muscle activity. So thinking about signs and symptoms with Parkinson, we're thinking about the loss of that inhibitory dopamine. So number one is going to be a tremor. It's called a pill rolling tremor. And you might see the patient doing something like this. Very classic to Parkinson. So next we have something called rigidity or cogwheel rigidity. And basically this is just kind of an abnormal resistance from the patient when you're trying to move them through passive range of motion exercises. Also something called bradykinesia. So this is very slowed movement when the patient is walking. You'll also see a shuffling gait that is very characteristic to patients with Parkinson's disease. Finally, a stooped posture and issues with balance. So falls and safety is huge with our patients with Parkinson's disease. Finally, we have Huntington disease. This is an autosomal dominant disorder, so it is inherited, and it causes atrophy of neurons within the basal ganglia and the frontal cortex. So what that's going to lead to is depletion of something called GABA, which plays a really important role in the signs and symptoms that we're going to see. So Huntington's is kind of unique. So there is an issue within the basal ganglia and there's an issue within the frontal cortex. So with the basal ganglia and GABA, that's going to have to do with movement. So with depletion of GABA and with depletion of those neurons within the basal ganglia, we're going to see the patient display very abnormal movements. Something that is very characteristic to Huntington disease is something called Huntington chorea or choreiform movements. These are almost like snake-like movements, and they are completely involuntary on the part of the patient and very, very characteristic of Huntington disease. Also, because the frontal cortex is affected, and remember the frontal lobe, that's where our personality comes from, our intellect, our cognition, all those things come from the frontal lobe. And so since the frontal cortex is affected, there's going to be very, very obvious cognitive changes in the patient. There's going to be psychiatric issues ranging from depression and anxiety all the way to psychosis. Also in patients with Huntington disease, dementia is one of those things that sets in the later stages as part of the cognitive decline. So with Huntington, not only do we have those abnormal involuntary movements, which are called Huntington's chorea, but there's very significant intellectual impairment, cognitive impairment, and psychiatric and behavioral issues as well. I hope this quick little overview of multiple sclerosis, Parkinson, and Huntington has been helpful. Follow for more. Let me know what you want to see more of, and go Vols.